Hi, my name's Millie. I'm a physiotherapist and I've been working in the NHS and in the private sector for the last 7 years.
Hi, I'm Daljit. I'm waiting for knee surgery because I've been suffering with arthritis for a while.
So this video today is going to take you through a series of exercises that you can do for your knees, both before and after your knee surgery. They all can be done at home and you're just going to need some equipment that you have already in the house. We're going to take you through from the easiest exercises through to the hardest exercises.
How important is it for us to do the exercises before and after the surgery?
Yeah, so it's really important to stay active both before and after your surgery. So doing your exercises and keeping strong is going to get you back to the things you love and your goals much sooner.
What if I experience pain during the exercises?
Yeah, so having some pain or discomfort can be normal when you're doing your exercises before and after your surgery. But if you are doing your exercises and you do have pain, the most important thing is to just listen to your body and adapt the exercises in a way that makes them comfortable for you. If you're feeling pain and that lasts for about 30 minutes after doing your exercises, then next time you come to do them, just reduce them down and make them a little bit easier. Your healthcare professional will help you after your surgery to make sure that you're doing the exercises in the right way for you. The first 3 exercises in this video are all stretching exercises. Before your surgery, it's absolutely fine to do some stretches nice and gently, but after your surgery, it's essential that we do the stretches really quickly after your operation to make sure that you get back to bending your knee and straightening your knee. And this is going to help you get back to your daily activities, but also walking. So the first exercise is working on the straightening of your knee. What you're going to do is sit comfortably in a chair and have a chair directly opposite you. You're going to lift your leg up and pop your heel onto the chair, and then you're going to let gravity just pull your knee down towards the floor. You can make this harder by holding up above the knee and just pushing down slightly on your thigh just to get more of a stretch down the back of the leg. And then to make this even harder, you can grab your oven gloves with your tins of beans inside to add some weight, and then you're going to drape the oven gloves over your knee, and that's going to add even more weight into the stretch. You can hold this anywhere between 5 to 30 seconds, depending on how you tolerate it, but the longer the hold, the better the stretch. So sitting comfortably, lift your leg up onto the chair. Good, and then just letting gravity pull your knee down, and you can add a bit of pressure. We're going to hold that for 10 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great. And then pop your knee down. How did that feel?
It felt really good. You could feel the stretch on both sides.
Good. So it's really important when you're doing this exercise to feel the stretch whilst you're doing it. So make sure you're choosing an option and a number of seconds so that you're getting that stretch down the back of the leg. This next exercise is the heel slide exercise, which is a stretching exercise for the bending of your knee. So what you're going to do is come to the bed or your sofa, whichever is more comfortable for you. You're going to lower yourself down safely, and then you're going to bring one leg round and the other leg round. Okay, you're going to slide your heel up towards you as far as you can go, nice and gently, and then bringing the heel away. Okay, shall we give that a go together?
Yes, let's go.
So sliding the heel up towards your sit bone and then away. Bringing the heel in and away. In and away. In and away. In and away. Excellent. How does that feel?
Yeah, it feels good.
Yeah?
Yeah.
It's good to get a knee bend and just to start off gently, and then you can build yourself up as time goes on. Our next exercise is work on the muscles at the front of the leg, your quadricep muscles. And these are really important muscles to support the knee. So you're going to need to be sitting on your sofa or in bed, whichever is more comfortable for you. You're going to need to take a rolled up towel and pop it underneath your knee so that you have got a small bend in your knee. You're then going to push your knee down into the towel, and you might find that your heel comes up off of the bed. That's absolutely fine. You're going to hold this between 5 and 10 seconds as long as you can tolerate, and then relax. To make this more advanced, you're going to take the towel away. You're going to do the same thing with your knee by pushing it down into the bed so that that muscle on the top of the thigh is working really hard. And then you're going to just lift that leg all the way up in the air and then lower it back down. To make this just a little bit more advanced, you can even bring the foot up towards you, push the knee down, and then lift the leg up. Shall we give those a go?
Yes.
Okay. There you go.
Thank you.
Good, and then pushing your knee down as hard as you can into the towel and holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good, and release. Good. We'll take the towel out and we'll give the more advanced option a go. So same thing, you're going to push your knee down into the bed, really get that quad muscle activated, and now lift the leg up into the air and down, up and down, up and down, up and down, up and down. How does that feel?
Yeah, it feels good. You can feel the stretch all up here.
Perfect. So this is a really big exercise for the muscles at the front of the leg. So that's probably where you'll be feeling it. Our next exercise is another knee bending exercise where you're going to need to be lying on your front, either on the bed or on the sofa, whichever is more comfortable for you. So bringing yourself round onto your front. Making sure you're comfortable, and you can relax your head down if you feel like you would like to, and then just bend your knee and bring your heel as close to your bottom as you can, and then nice and controlled, lower the foot back down to the bed. You can do this exercise multiple times a day, maybe before you get out of bed in the morning or before you go to sleep in the evening, but doing it regularly is really good. Okay, so lifting the heel, bending the knee, up and lowering down. Lifting up, lowering down. Up and down, up and down, up and down. Great. How did that one feel?
Yeah, it felt really good. You could feel like the stretch in the whole leg.
Mm-hmm. This is a really good exercise because the bending of the knee also stretches the knee, but it also strengthens at the back of the hamstring too. Our next exercise is a strengthening exercise for the glute muscles, which are your bottom muscles. These muscles help to support your legs and also your knee, so it's important that we strengthen them. For the first one, we're going to be just doing glute squeezes. You're going to sit comfortably in the bed or on your sofa, whichever is more comfortable, and you're just going to squeeze your bottom muscles together as hard as you can, hold for between 5 to 10 seconds as long as you can tolerate, and then you're going to relax and then repeat. You can also do this lying completely flat on your back if you prefer. To advance on from this, we're going to be doing a bridge exercise. So for this one, lie flat on your back. Bend your knees and then bring your heels as close to your bottom as you can. And then you're going to squeeze your bottom muscles again. So do that glute squeeze again, and then lift your hips up off of the bed and then coming back down and repeating. For your bridging exercise, you can repeat that 10 times and you can do that a few times throughout the day. Do you want to give that a go?
Yes.
So squeezing your glutes together and holding as hard as you can. And we're going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax. How did that feel?
Yeah, it felt really good. You could feel the stretch in the bottom.
Perfect, good. So that shows us that your glute muscles are working. So when you're doing this exercise, make sure you can feel those muscles and hold for the amount of seconds that means that they start to work quite hard. These next exercises are a little bit more advanced because they're a bit more strengthening of the legs. They are great to do before your surgery and a few weeks after your surgery, but your healthcare professional will help to guide you as to when you're ready to do them. If you do them and they feel a bit difficult, then do just ease off of them and listen to your body. Come back to them when you're feeling a bit stronger. Our next exercise is the squat exercise. So make sure you're standing at something sturdy that can support you if you need to hold on. That can be the back of a chair, the bed, the table, or even the kitchen counter. So standing with your feet about hip width apart, you're going to come down into your squat and then use those glute squeezes we practiced earlier as you come up into standing. As you get better at the squat, you can take your hands off of the support, you can bend deeper into the squat, or you can grab those tins of beans again and you can use a small weight. Shall we do those together?
Sure.
Okay, so holding on to start with, we're bending down into the squat and up. Down, up, down, up, down, up, down, and up. Great. How did those ones feel?
Yeah, they felt really good. You could feel the pressure on the knees and the stretch at the back of the leg.
Perfect, good. So as you get a bit stronger, you'll be able to take your hands off and go a bit deeper into the squat. Our next exercise is the lunge exercise, which is a really good exercise for the strengthening of your legs and also for balance. So holding on to something sturdy, you're going to take one big step forwards and then you're going to bend both knees down to the floor. And then as you come back up, you're going to do that glute squeeze that we practiced earlier. So coming down, glute squeeze, come back up. As you get more advanced, you can practice by taking your hands off, coming down and up. And if you want to advance it even more, you can hold on to the tin of beans to add some weight. Should we do that together?
Sure.
Okay.
So,
Stepping forwards. Good. Bending both knees down and up. Down and up. Down. Up. Down. Up. Down and up. Great, step back. How did that one feel?
yeah, it felt good. I could feel the stretch, and plus I could hear the noises from the knees.
Yeah, perfect. So feeling the stretch and hearing the noises are absolutely fine. If your knee is making noises but it's not painful, then you're fine to carry on with the exercise. Our next exercise is the wall squat, which is a variation of the sit to stand and the squat that we did earlier. So find yourself a place where the wall is clear and you're going to bring yourself about 30 centimeters away from the wall. Lean yourself back against the wall and have something sturdy next to you for some support. You're going to slide yourself down the wall as far as you can go in a pain-free range, and then you're going to bring yourself back up the wall, squeezing your glutes as we practiced before as you go. So coming down and then squeezing up. You can make this harder by taking your hand off of the sturdy supports, and then you can make it even harder as well by getting back your tin of beans and holding something heavy as you do the exercise. Leaning yourself back, feet hip width apart, great. And then sliding yourself down as far as you can go, squeezing your glutes up. Lean yourself against the wall, that's it. Come down and up, down and up. Down, up, down, up, down, and up. Great. How was that one for you?
Yeah, that was really good. You could feel like the whole body at the same time.
Good. It's quite hard on your glute muscles, so the better you get and the stronger you get, the further down you can slide on the wall. So just progress yourself into it as you get stronger. So the step up exercise is a really good exercise for the muscles in your leg and for your balance. It's really going to help with getting the bend back in your knee after surgery, and it's also going to help you get back to doing the stairs more independently. So you're going to have a step that you have at home. You're going to put one foot on the step and don't have any of your heel hanging off of the edge of the step. Whole foot on, stepping up, and then bringing that leg back down. Stepping up and back down. If you need to hold onto the wall or your banister for some stability to start with, then that's fine, and you can progress to not holding onto anything. Should we do that together?
Sure.
Okay. So foot on the step, and make sure your whole foot's on the step, hands on your hips, and then pushing yourself up, stepping back. Up and down. Good. Up, down, up, down, up, and down. Perfect. How was that one for you?
Yeah, you can feel a whole stretch in, like, obviously your legs, but in your arms as well.
Good.
By balancing them on my hips.
Perfect. So it's a whole body exercise and it really helps with the stairs. Our next exercise is the sit to stand exercise, which really helps you to build the muscles in your legs. So you're going to take your feet about hip width apart. If you're just starting out, you can use a chair that has got armrests so that you can help to push yourself up. But if you're more advanced, then you can go without using your hands. So you're going to push yourself up into standing. Use those glute squeezes that we practiced earlier as you come up, and then as you come down you're going to reach back for the chair so that you know where to go, and then you're going to bend yourself back down into sitting. Push yourself back up and then bring yourself back down. Okay, let's go together.
Sure.
Okay, so up and down. 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 Good. How were those ones for you?
Yeah, they were really good. You can feel the pressure in the front and the back.
Perfect. So it's an all-round exercise for your legs. Well done everyone for doing all of those exercises and working so hard. How did you find those exercises today?
I found them very well. It wasn't too aggressive. It was, I could do it at my own pace.
Can you think of any time as to when you might incorporate them into your daily routine?
As we went through them, I realised the ones I want to do first thing in the morning to start my body, the ones in the afternoon, and then the ones in the evening to relax before I sleep.
Yeah, amazing. That's a really nice tip to help you pace yourself whilst you're doing the exercises. And other things you could do as well are just incorporating them into your day when you're standing in the kitchen or going up the stairs, or maybe every time that you need to stand up, you could do a few sit to stands. If you need any more information, then do check out the Versus Arthritis Surgery Toolkit online. For now, keep doing your exercises and we'll see you soon. Take care.